this was a patient who presented with abdominal pain. You guys can see and hear me, right? So you can see that their liver is severely fatty, and they have this mass that's either arising from the liver capsule or extracapsular. They also have another couple of masses here and here. They have one in the omentum, one in the subcutaneous tissues. So does anyone have any ideas what these could be?
Worry about metastatic deposits or maybe splenules. Yeah, I just looked at the spleen as you scrolled up there.
Yeah, I was trying to show you guys exactly. So Amar also got splenosis, and GW also did. So good. So the clue is that there's like this weird spleen up here, and then that these are very, you know, kind of lenticular, avidly enhancing. They're random. So I just want to show you a few more images. So this was the CT, and pay attention to the pancreas, because the pancreatic tail, there is a little bit of stranding around it, and maybe a tiny bit around the head. And I'm just going to show you the MRI that was done a few hours later, and you'll see that it's much more dramatic on the MRI. So this was the T2 fat set, and you can see how dramatic this pancreatitis. So this was acute interstitial pancreatitis. It probably got worse by the MRI, but it was pretty dramatic here. And then the splenule, or the splenosis, showing up over here. It's similar to the remnant spleen over there. And on the in and out of phase, one of the clues, if you're looking for like an accessory spleen or a splenule, is that it looks like the spleen on, well, anyway, I don't know what just happened. Comparison in this frame. Okay. Sorry. So here's the out of phase on the left and the in phase on the right. And you can see that the liver is very fatty. It's dropping on the out of phase. And that, for example, this lesion is getting darker on the in phase. So it has iron deposition or hemosiderosis. And same thing with the remnant spleen up here. It's getting darker. So there's iron deposition in just the spleen in this case. But all of the lesions had that iron deposition. So we knew it was all part of the same process and was likely splenosis. So I just have a couple of slides about it. So most of cases of splenosis are post-traumatic deposits. You can get them anywhere in the body, but the most common places are going to be in your abdomen and pelvis, your subcutaneous tissues where they might have done surgery, or along the pleura if the diaphragm was ruptured. In 65% of traumatic cases where there's splenic rupture, you'll get splenosis in the long term. There was one case report of splenosis that mimicked a meningioma in the brain, which brought up the very rare possibility of hematogenic spread of splenic tissue. So that's just kind of to tuck away, but I would say, like, if you're reading a brain study, don't bring up splenosis. In general, these guys parasitize vascular flow from any nearby vessel, and they can grow over time. And I'm gonna go over a little bit about which tissues, because that is kind of interesting to me. Lately, I've been thinking about, you know, which tissues have stem cells or pluripotent cells that can regenerate. Generally, the spleen does not just regenerate. Like if you were to do half splenectomy, it doesn't grow back like the way that the liver does. But these splenic deposits can grow. Some people have actually done splenic transplants. So if they were going to be removing the spleen for some reason, they've taken small pieces of tissue and put it on the omentum. And it seems that both, whether it's traumatic or because they auto-transplanted them, these splenic deposits can give you an immune benefit. So they have done tests where these patients are less vulnerable to pneumonia, meningococcus, and flu. Normally, if they do a splenectomy, they have to vaccinate against all three of these. The way that you can diagnose this is that it's going to follow the spleen on all sequences. So if you still have part of a spleen or a normal spleen, especially on DWI, the spleen tends to be very bright, or on T2, it tends to be intermediate. One helpful thing would be a pheromoxetol MRI. We don't usually do those these days because there was a black box warning, but that can that's avidly taken up by the spleen. Or you can do a sulfur colloid technetium heat damaged scan. And then a final point about tissues growing and regenerating. So the liver has unipotent hepatocytes. So even if you only need about 25% of your liver to survive, but if you do a hepatectomy and you have this remnant liver left, it can strongly regenerate because the hepatocytes can dedifferentiate back into sort of stem cells that can regenerate. The skin only takes about 2 weeks to regenerate. You can actually regenerate fingertips. So there was multiple cases, if you chop off like your fingertip, it will actually regenerate. So that's hope for people like, I guess, cooking at home. The endometrium is the most avidly regenerating tissue in women. And then the vas deferens, even 5 centimeters long, can regenerate. I think this is probably like an evolutionary benefit. Like, you know, if the vas gets injured, the human species wants to keep going. But unfortunately, this can also lead to vasectomy failure. So just something to know. They're now doing more regeneration like in the Petri dish. So these aren't like natural regeneration if you get injured, but they have been able to grow some glomeruli, pieces of heart. So they're really working avidly on these in like the scientific setting to try to see if we can regenerate some of these organs.